Good morning. It's great to be with you today. And I am totally psyched listening to you and the Federal Reserve and to you, Paul Wilder, and having a chance to see the posters. I think that this theme of cross-sector collaboration is alive and working, and I feel, in a sense, we're speaking to the choir, but we all know, as you were saying, it's really kind of hard, particularly to work across agencies. So, I think having all of us reiterate this theme and support each other in the tough work that it is to cross-collaborate is sort of the next step. And Paul, I was pleased to see that that's the purpose of the conference this year. So, as Paul said, I'm going to talk a little bit about the Commission to Build a Healthier America. How many of you have heard of that one? Okay, so I'll tell you a little bit about what's happening. So, we too say we're not going to be able to fill our mission to improve health and health care for all Americans working in the health and healthcare sectors. It's taken us 40 years to figure that out, but I think we're there now. And so in 2008, as Paul was saying, looking at the social determinants of health, we brought together this commission to say, how can we improve America's health working outside of the doctor's office? No physicians on the commission. And so there were 10 recommendations released, and there's been a lot of change in the environment, not just due to the commission, but a lot of action since then. And just a couple of examples: Healthy Food Financing Initiative, which I think you're probably familiar with, and Yael will be addressing later on. The increase in the number of farmers markets that accept SNAP or food stamps. There was a specific recommendation for health impact assessments to show how a new plan or a new policy or a new infrastructure building project would affect health in a positive or negative way. There have been more than 200 of those around the country. And the Centers for Disease Control, that's this CDC, has a whole community transformation program to support cross-sector collaboration. Our commission report has about 10 pages of these. The point here is that the environment has changed. There's been progress. We still have a lot of problems. So RWJ brought back the commission to say, hey, look, most of your 10 commissions were framed in 2 areas. How do we help our youngest children from age 0 to 5 to predict okay? Oh, you like that one? To make sure that they have the best start in health and in life. And the second was a whole frame. Half of the recommendations dealt with how do we make communities healthier so the people who live there can be healthier. So I want to tell you a little bit about where the commission is, what they've heard, what their overarching themes are, and prepare you for the release on January 13. The commissioners have been working and learning about each other since last spring, and we brought them all together in June in Washington, D.C., where there were site visits to Educare, Early Childhood Development Program. There was public testimony for a day, and Elaine and Paul were there to talk to the commissioners, and David Erickson and others here, and a lot of closed deliberations. And we've been working with this group ever since to come to some consensus across these 16 people. I see that some of you recognize Art Rolnick, who was one of our testifying on the Early Childhood Development panel. And he's there with our the other experts are to his right. And to the left are our co-chairs, Alice Rivlin, who some of you may know, and Mark McClellan. And here they are, the whole group. And what I want to say about them is it's very diverse. It's bipartisan. We have Mitch Daniels, the former governor of Indiana, and a great assortment of people. Shirley Franklin, who's the head of Purpose Built. So they didn't know each other. About half of them are new to the commission, and they bring very different world perspectives. They heard about these 2 areas, and I want just a quick snapshot of things that they heard. that, first of all, at-risk children are more likely to arrive at kindergarten already a year or more behind their peers, and they may never catch up. The second thing is that at-risk children without high-quality early childhood intervention services are 25% more likely to drop out of school. And these same vulnerable children who most need help in early childhood development are the least likely to get it. And about that high school graduation, that is the leading health indicator of health in adults, even more so than race, ethnicity, or poverty, income. In addition to this readiness to learn and to be able to be successful in education, we now know from basic neurological research that adverse exposures in these very early years, beginning at birth, where there's toxic stress, it's exposure to adverse conditions within a home, within a community, really affect the way your brain develops. And when your brain does not develop and your body does not develop in those very early years, there are lifelong implications. You will, across a lifetime, be at higher risk for chronic diseases, for example. So if we can't help these kids right then when their bodies are developing, we've lost a lifelong opportunity. And I see Rob over here. I could have you do this slide. $1 spent on early childhood services is a great investment. So a little bit on healthy communities. This is a DC map because Paul had the Minneapolis map. You know, our tagline is always, your zip code may be more important than your genetic code. Now, I'm from Washington, D.C. This is the Red Line Metro. If you live downtown, there's, like Paul said, the same kind of thing happening in D.C. There's 7 years difference in life expectancy at birth. So this is just showing the importance of where you live, learn, work, and play, where you can have an opportunity to get a good education, job training, a good job, live in a place where you can make healthy choices or not. Everybody, of course, has a responsibility for their own life and their own health. However, some people live in communities where the barriers to making a healthy decision are so great that even when the motivation is high, they don't. They have no opportunity to do it. So that's why we are in this, as David Erickson says, the zip code improving business. This is really the basis, fundamental basis for this, this partnership between the Federal Reserve and the Foundation. And these heat maps are from Jonathan Fielding at their Los Angeles County. And the map on the left shows economic hardship, low income. And the one on the right shows the rate of childhood obesity. So you look at these maps and what do you see? They're the same. So when you look at neighborhoods, it becomes obvious that we have the same populations to deal with, the same neighborhoods, and it just becomes obvious why we need to be working together. Now, zooming out from a neighborhood to the nation, nearly a fifth of all Americans, about 52 million people, live in poor neighborhoods with few opportunities. So we were also looking at models, and how many of you are familiar with purpose-built? Okay, this is one. We looked at a whole series with the commission of big and small models. The point is that in redeveloping a really low-income neighborhood, they just didn't build new schools and new housing, but what they said was, how can we change the whole look and feel of this community? It shouldn't be low income, it should be mixed income. They built mixed income housing, it brought in retail, it brought in better schools, and they went from 1,400 extremely low income residents to 2,100 mixed income residents in the neighborhood, so it was no longer isolated, and the 13% employment rate went 13% employment, not unemployment, went to 70% employment, and the school in that area, which was out of 69 schools in the Atlanta area was right at the bottom, is now number 4. So what happened? Instead of going in to change the buildings, they said, let's change what this neighborhood is and what it means to the people. So as David was saying, instead of working to build the infrastructure, the place, they were working to improve the lives of the people who live there. So that's a very quick, I could tell you hours worth of things that the commissioners have said, but so what do you do with this information? So I want to tell you about, because I can't give you all the recommendations, I want to tell you what they are thinking, right? So obviously to improve health, we need to improve what influences health, community, education, and income. Now, it's one thing to say we're working on social determinants of health. It's another to say we're working across sectors, and really important. But I think it is vital that we have a statement in this country that says unless we improve education, we can't improve health. Unless we improve access to jobs, skills, we can't improve education, we can't improve health. And what happens, of course, is that when we recognize there's this huge mix, it becomes a more complex situation. But if we're working together on it and we each can say, okay, this is what we can do, what can you do, and start to tackle it in that way, I think it becomes controllable again. So that's sort of what we're looking at. It's tough. It means that we all have to work outside of our comfort zones, be willing to negotiate with people who have a different goal, but a similar mission or aim. So the second thing is we're using 20th century strategies to address our problems. Well, no wonder we're failing, right? So again, David would say that community development is mired in what the design was 40 years ago with the Reinvestment Act. Well, we find that the same thing is true in early childhood. Head Start is decades old. That is our answer for low-income kids. Only 40% of eligible kids even receive it, but when they do, it's way before the brain research. It's way before we knew how to help these kids. And the same is true for the healthcare system. Now, we said look outside the doctor's office, and the commissioners said, wait, you can't leave out the healthcare system. We spend $2.5 trillion a year on it. And look at how, 20th century that is. They're not looking outside the doctor's office either. So one thing that there will be are recommendations to the healthcare sector saying, you need to look at why your patient is sick. Why, for example, is a woman not taking insulin? Is it because she doesn't have transportation to get the pharmacy, or she doesn't have the money? So you can't just look at a prescription. You have to look at all total lives. So we'll be looking at that as well. Now, the next one, our economy is not strong. Giggle. So yeah, well, this is no surprise, but what does it mean? We're a bipartisan commission, and all points of view on the economy as well as on health. And it's clear that we can't just throw money at this. And not only is it because our economy is not strong, but because throwing money at it is not what we need. We need the new strategies. We need to look at policies that support change or block change. And we're just, we need to work more efficiently. We need to work together. So the commission is not going to be saying, let's have new federal programs. We're going to say, here's some ways that we need to work more efficiently with better outcomes. So obviously, cross-sector collaboration is essential. And again, I think, that I don't need to say this to this group, but we need to be working on all these factors together. So I want to especially thank Paul and Ela for talking to the commissioners and for this great report that's in your folder that was a result of reaching out to the people who've been to Healthy Communities conferences. And I want to tell you just one slide. 65% of the people who had attended one of these conferences believe the initiative has helped increase collaboration between local community development and health agencies. And 71% reported involvement in a cross-sector project that they considered successful. So, wow. I mean, I think everybody is ready for this. To me, it says, hey, this is, spurring people on, but clearly they're ready. And, it's wonderful to see that this conference is about action. And there are a series of recommendations here that I hope that you will read, talking about the new skills that we all need to be able to understand and listen and negotiate if we're going to be successful in working together across sectors. So turning for a minute to Minnesota, the reason I am here is Minnesota is leading in so many ways. How many of you already know 5th overall compared to other states? I mean, if you look at the state, very healthy place to be. Congratulations. Yay. However, if you look more granular, and I'm so sorry, this says Hennepin County, and I know we're in Ramsey. Look at in the county, at the county level. Paul was showing you neighborhoods. In the county level, Ramsey County is 65th in the state. So those sorts of things that we were seeing in the LA heat maps, you know, is true in every place that we live. It's all the neighborhood you live in. So, you know, I don't want you to rest on your laurels. I want you to be a leader. And so if you listen to David Fleming, who is the health director for Seattle, which we consider another very healthy place. Look at this. The dark red census tracts are 100 years behind the dark blue ones compared with the best performing developed countries. It would take 100 years for the people living in those places to catch up with people living in European countries. That's pretty sobering. So, however, I do want to say that the commissioners have heard a lot of examples from Minnesota. It's great to have such a treasure trove of good work here, and I'm going to just put these up and not even talk about them because as I saw the posters, there's so many other wonderful examples, but here are some of the ones that the commissioners have heard about in depth: the St. Paul Early Childhood Scholarship Program, the Isaiah collaboration, the advocacy that got more stops on the new light rail in low-income communities so people there would have access to transportation, to better jobs, and to health. And big congratulations. The RWJ National Competition, Roadmaps to Health, Minneapolis city government and more than 40 community organizations came together and they were a winner. And I was dying to announce this last year, and it was just a couple of weeks after how many of you have been involved in this? Okay, so there is a website, countyhealthrankings.org, and there's lots of information about this program. And finally, the Northside Achievement Zone. How many of you know about this one? Yeah, okay, so I don't need to go into it, but I would love to have all of the ones here on posters as a part of this, and I've already talked to Ela, and we'll be promoting them on our website when they're available. So again, it's just wonderful. So what's next? I mean, what's next for Minnesota and what's next for the commission? Well, I hope that there's some synergy there. You are a national leader. I mean, nobody is without problems, but you are a leader. You're facing the challenges. You've got successes. We're seeing them here. There is collaboration. Every poster that I went to, people said it's because of collaboration that we're doing this. Now, this is great for me to see. Now, I'm from Washington, D.C., the home of dysfunction. So I really admire this, and I know it doesn't come easy, and maybe it's part of the Minnesota nice, but it's wonderful to be able to say it is possible. And you're therefore poised for more success sooner. There's so many things. This innovation should be innovation evidence / you know, it is obvious that you're willing to step out and try things and nurture innovation, but at the same time, gather the evidence so you know what works and what's ready for spread. And you can show the way. You can show the way to others in the Minneapolis-St. Paul area. You can show the way to Minnesota, and you can show the way to other states and to national and federal partners. So the commission release is January 13, and it's going to be a national webinar because we didn't want a Washington event. Things are not happening in Washington. Big surprise, right? So the idea is that we want everyone in every state to have access, and it will be an online webinar, but it's interactive. That means that the people who are on the webinar will be ask polling questions and ask for feedback even as the webinar is going on. And it's going to be, the recommendations will be for the nation. And we're going to do everything we can to promote change at the national level in policies and programs and funding where we need to do that. But we hope that you in this room will be the lead for Minnesota. So we hope that you'll get involved. Obviously, we want you to promote the webinar. We want you to see it. People are talking about watch parties around the country. Give us feedback, both during the webinar and afterwards. I love this. Our communications support always says you have to talk about Twitter, so it's here. But the point is, in every way you can, whether it's blogging, whether you're following Twitter, talking to people, you know, talking through local media, meeting, planning, you know, we hope that this will be a catalyst for advocacy in this state. We hope that you will use the commission recommendations as a way to push your own agenda. That's really the purpose. As you can say, this National Bipartisan Commission said this, and this is how we can do it. We also hope you'll engage the commissioners. Now, our staff director is David Williams at Harvard University, and he has spoken at a lot of the Healthy Communities conferences, and I'm sure he'll be willing to do that again, and also our commissioners would be glad to speak out as well. So, Paul, thank you very much for inviting me. Ela, thank you all.